In the study, the efficacy of Tislelizumab was evaluated. It was a large Phase III study with a mono checkpoint therapy compared to Sorafenib. The study was positive, and non-inferiority of Tislelizumab compared to Sorafenib was shown. And here in this post-hoc analysis, we asked the question whether there would be a difference in efficacy for the elderly population. And so, I mean, we know that in Western countries, Europe and the US, the majority of the patients belong to the elderly population compared to the Asian patients, in which you have a lot of younger patients with hepatitis B infection and also in non-cirrhotic livers, actually. Yeah. So considering that we have the elderly population, I think it's an important question to understand whether we have a similar efficacy and safety in this patient population. And around 1/3 of the patients belong to this elderly population, which was defined as 65 years of age. And interestingly, well, maybe not so surprising, the majority of these patients were actually from Western countries compared to the overall population. And with that, the baseline characteristics were also different compared to the overall population. One point which is related to the location of the patient is that we had fewer patients with an hepatitis B infection. Another point which was for me kind of surprising was that more patients in the elderly population were in a lower disease stage. So we had more patients BCLC-B in the elderly population compared to the overall population, where we had more BCLC-C, more advanced stage patients. And I think this is important to understand the results, because we observed that actually the overall survival in the elderly population was better compared to the overall population for Tislelizumab. So here, median overall survival was 18 months compared to 15.9 months in the overall population. And this was actually also longer compared to Sorafenib with only 14 months, which was actually quite similar to the 14-month we have observed in the overall population. So I think our data revealed that, and there were no new safety signals for the elderly population. So safety was similar in the elderly population compared to the overall population. And I think overall our data indicate that Tislelizumab has efficacy. It was a post-hoc analysis, so no statistical tests were performed, but it appears that this effect was specific for the checkpoint inhibitor. It was not seen for Sorafenib. And no new safety signals, I think, which is also reassuring that we can use the checkpoint inhibitors in the elderly population.